What is the effect of hypothermia on drug metabolism during DHCA? A. Speeds up hepatic clearance. B. Increases renal elimination. C. Slows hepatic metabolism and renal clearance. D. Has no effect on pharmacokinetics. Answer: C. Slows hepatic metabolism and renal clearance. Explanation: hypothermia slows enzymatic activity in the liver and decreases renal perfusion, leading to slower metabolism and excretion of drugs. This alters the expected pharmacokinetics of anesthetic and vasoactive agents during DHCA. Which of the following is most important to prevent spinal cord ischemia in surgeries involving the descending thoracic aorta with DHCA? A. Keeping blood glucose high. B. High-dose vasopressors. C. Cerebrospinal fluid, CSF, drainage and distal perfusion. D. Aggressive diuresis. Answer: C. Cerebrospinal fluid, CSF, drainage and distal perfusion. Explanation: spinal cord protection strategies include CSF drainage, to reduce intrathecal pressure, and distal aortic perfusion, to maintain spinal cord blood flow, during prolonged DHCA for descending thoracic and thoracoabdominal repairs. Which of the following changes in arterial blood gas analysis is expected during deep hypothermia when measured using alpha-stat management? A. PaCO2 is actively corrected to normothermic value. B. pH is corrected for actual patient temperature. C. Acid-base status is interpreted at 37 degrees Celsius regardless of actual temp. D. Base excess is not measurable. Answer: C. Acid-base status is interpreted at 37 degrees Celsius regardless of actual temp. Explanation: alpha-stat management keeps pH uncorrected for temperature, i.e., values are interpreted at 37 degrees Celsius. It preserves intracellular enzyme function and cerebral autoregulation better than pH stat in adults. What is the primary disadvantage of pH stat strategy during DHCA compared to alpha-stat? A. Increased cerebral embolism risk due to vasodilation. B. Decreased cerebral blood flow. C. Loss of temperature control. D. Ineffective in pediatric patients. Answer: A. Increased cerebral embolism risk due to vasodilation. Explanation: pH stat management involves adding CO2 to correct pH, which causes cerebral vasodilation, increasing blood flow, but also the risk of air or particulate emboli. It may be beneficial in neonates but is used cautiously in adults. Which of the following is the primary determinant of the safe duration of circulatory arrest during DHCA? A. Cardiopulmonary bypass pump flow rate. B. Cerebral temperature. C. Hematocrit level. D. Oxygen saturation of venous return. Answer: B. Cerebral temperature. Explanation: the level of cerebral cooling directly determines how long the brain can tolerate the absence of blood flow. At 18 degrees Celsius, safe arrest time is 30 minutes. Lower temperatures extend this safe window. Which of the following interventions during DHCA is associated with improved neurologic outcomes in pediatric patients? A. Use of room temperature perfusion. B. pH stat blood gas management strategy. C. Prolonged cooling time without perfusion. D. Hyperglycemia during cooling. Answer: B. pH stat blood gas management strategy. Explanation: in neonates and infants, pH stat, CO2 addition to maintain pH, improves cerebral perfusion and homogeneous cooling, potentially reducing neurologic injury. It causes cerebral vasodilation, enhancing even cooling. Which of the following adverse events is most associated with rapid rewarming after DHCA? A. Bradycardia. B. Coagulopathy. C. Cerebral hyperthermia. D. Hypervolemia. Answer: C. Cerebral hyperthermia. Explanation: fast rewarming can lead to disproportionate warming of the brain, leading to hyperthermia and exacerbated neuronal injury. Controlled, gradual rewarming is key to safe DHCA practices. Which of the following best describes the rationale for targeting a lower hematocrit, 20 to 25%, during DHCA? A. It reduces cardiac workload. B. It minimizes coagulopathy. C. It improves microcirculatory flow during hypothermia. D. It increases oxygen carrying capacity. Answer: C. It improves microcirculatory flow during hypothermia. Explanation: hypothermia increases blood viscosity, thus, a lower hematocrit helps maintain better microcirculatory perfusion. However, it's balanced to ensure adequate oxygen carrying capacity. Why is mannitol sometimes administered before initiating DHCA? A. To decrease intravascular volume. B. To induce diuresis for renal protection. C. To reduce cerebral edema and act as a free radical scavenger. D. To reduce blood pressure during cooling. Answer: C. To reduce cerebral edema and act as a free radical scavenger. Explanation: mannitol is an osmotic diuretic that helps reduce cerebral edema and acts as an antioxidant, reducing ischemia-reperfusion injury during DHCA and rewarming. Which of the following parameters is most critical to monitor during cooling to ensure adequate cerebral protection during DHCA? A. Central venous pressure, CVP. B. Mean arterial pressure, MAP. C. Nasopharyngeal temperature. D. Urine output. Answer: C. Nasopharyngeal temperature. Explanation: nasopharyngeal temperature reflects brain temperature and guides the timing of circulatory arrest and rewarming during DHCA. It's the most direct estimate of cerebral thermal state.